Today we're going to be talking about introduction and literature review, justification, problem statement and aims and objectives, hypothesis and hypothesis testing, and outcome measures, which inclusion and exclusion criteria. So you're all welcome. And each presenter is going to spend 15 minutes. And we expect that as you come in, please put your phones on silent. And then if you have any questions, you can actually put them in the chat box. I will address them as the time goes on. Good evening and welcome. We have 2 minutes more to start. Mr. Chairman, sir, do you have any statement to make before we continue? Okay, the chairman is trying to unmute himself. Maybe you can enable him to do that because I think I've not been given the hosting rights myself. Okay, I'm a co-host.
All right. Good evening.
Yes.
Good. Thank you, Madam Moderator. I've been trying to unmute myself. I couldn't.
No, sorry,
thank
sir.
you very much. It's okay. I mean, that's the guidelines we have here. So good evening once again, everybody. Let me welcome our senior colleagues and dear residents. This is mainly a joint seminar to educate all of us, both the trainers and the residents also. So thank you, Madam Moderator, and thank you for coming to stand in at the short notice for Professor Aziken, who is actually in transit and may not be able to make this seminar. So I think Madam Moderator has laid down the ground rules. It's top of the hour now, and I think it's just kickstart the program. Thank you very much.
Thank you very much, Mr. Chairman. The first lecture is going to be by our dear Faculty Secretary, Dr. Oyuje Omera, who works as a consultant OBGYN at the Alex Ekweme Federal University Teaching Hospital, Abakaliki, and a professor at the ONG of ONG at the university. He is the faculty secretary of our dear faculty. So, Mr. Secretary, sir, the floor is yours. Thank you, sir. You have 15 minutes.
Okay, thank you, everybody. Thank you, Moderator Prof. Hajira. Thank you, the faculty chairman, and all my senior colleagues here, including Professor Bigbodu, Professor Etuk, and other very senior colleagues. And welcome, colleagues, to this evening. We've chosen to restart this program today to migrate us from Christmas to New Year celebration. So I hope we really had some good time during the Christmas. And let's remember, we still have some work to do. I'll be talking on writing high quality introduction for the proposal as we want it in our college. It was Chinua Achebe who said, if you do not know where you are going, any road will actually take you there. But some will take you one day, some will take you a few minutes, some will take you years, but somehow you can still get there. But research gives you the map, and that's exactly what introduction does, to give us a direction, to give us a focus, so that I can arrive at an answer at the shortest possible time using the minimal resources at our disposal. At the end of this lecture, I want us to really understand the purpose of introduction in the NP, National Postgraduate Medical College proposal. I want us to learn how to construct a logical, evidence-based narrative to give us a clear research problem. Because if you don't actually highlight the problem, you won't know what you're looking for. And in doing this, you must think locally. We must put everything within the context and of our local population right here in Nigeria. And again, I want us to avoid the common pitfalls that most of us make when writing introduction. So the introduction, I want us to picture this funnel. That's how introduction should be. It starts with a very, very broad base and then goes down, narrows us down to a particular focus, which is the research question, and then what we are going to do. So step one, we look at them step by step. You start broadly. Now look at, you have a topic. You look at the global burden of this condition, of the disease, of whatever you want to research into. You have to define it, tell us what it entails, and then give us the picture. How is this thing across the world? Why is it a burden? Is it of public health importance? How? What's the significance? So give us this global epidemiology. And in doing so, you must use verified and credible sources, WHO publication, FIGO, Lancet, very important journals, not just journals that are not peer reviewed or one study somewhere from one corner of the earth, but these things must be evidence-based. The more credible your sources the more credible your introduction and more persuasive will the introduction be and convincing to the reader. Stage two, now having looked at it at the global level, bring it down to Africa. Bring it down to West Africa. What is the problem with this? How does it situate in the sub-regional, in the regional and subcontinental perspective? So we must highlight the disparities from what you have in the Western world, in Asia, Europe, and what we have right here in Sub-Saharan Africa. You must highlight how the disparities, health disparities, equity, resource limitations, and the unique challenges of our population, how they might impact on this, on your topic. Then from there, we are now coming down, you focus on Nigeria. What is the national significance? How does this play into the health of the local population? And you must use data. We must use the data that are authentic in Nigeria from Federal Ministry of Health, Primary Health Care, the NDHS, and study from our association journals. The NJCP is there, the TJOG is there, and then from our institutional journals. All these are important because we are now narrowing it down to your locality. You must show where this problem is important in your locality, because if it's not important to the local population, to the source population, then there is no need. So you must code it down. Then you now look at what is known, because you must have gone through a lot of literature. What is known about this condition? Because I'm not going to reinvent the wheel, but tell us what is known, what is unknown. Are there any controversies or inconsistencies? Or have this thing actually been understood? We've just been looking at a particular point without looking at the others, and these are the areas that I want us to come in. And therefore, you are not showing us the gap. Not just showing the gap, you must tell us why it's important to fill this gap. That means the significance, the obstetric or gynecological significance, or public health significance must be highlighted in your introduction. Then all these things will now lead you to the rationale. So in the later part of the introduction, the rationale should be evident. Oh, this is the gap. This is the reason why this gap has to be filled. And therefore, you are reader, you assess and say, oh, okay, this is actually a worthwhile venture. So link the gap to patient outcomes, policy, and clinical practice, because this is the final sum. If you do research without it impacting or informing policy or clinical practice, then the research really is nothing, because you want to generate generalizable knowledge to impact on the health positively. Then, so these are the common, that's how, in a nutshell, that's what we want your introduction to be. You can see it's focused. You start from broad and then go down. Okay, so do not just start, just define, we are writing on fibroid, just define fibroid and leave it out without telling us what actually you want to discuss about that fibroid. Or you just get a lot of literature without even, from everywhere, no organization, just dump them there. At the end, you are studying in your locality in Ekiti, but there's no Nigerian data, no data from Southwest Nigeria, even though there have been a lot of studies there. And then at the end, one could not really discern a particular, a clear knowledge gap. If we can't discern that, then what are you doing? Really, it's not enough. Most of us say little is known about this, what we call the Leica syndrome. That's not enough. There must be a clear gap. There must be some inconsistency, controversies, new thing you want to generate. And again, like I said, all your introduction should be focused. For the proposal at the National College, don't give us 3, 4, 5, 6, 7 pages of introduction. 2 pages, maximum of 3 pages. Okay, so that you now stay focused, and then avoid some emotional language. Oh, this problem is so terrible, it's so devastating. Or even some journalistic. I was reading a proposal recently. The first thing I just wrote back to this guy, please make it scientific language. This is not newspaper publication. So you must be mindful of knowledge. So finally, these are what we take home for introduction. It is a strategic argument that there are some inconsistencies, controversies that you want to highlight and want to research into. You must follow the funnel structure, make sure Nigerian data is there, and the knowledge gap must be explicit. Please keep it concise, logical, and evidence-based. So I have just 15 minutes, so I have to hurry. And then we go into writing effective literature review. Now, Criswell was a original research design. He was talking about in research design, creative content of mixed methods in 2014. He said, literature review is not just a list describing or summarizing one piece of literature after another. Does that sound familiar? I'm sure that as many of us, that sounds so familiar because that's what you see. Summary of study A, after that study B, study C, study D, all in one paragraph, just packing one literature. That is not literature review. Actually, it should be a synthesis that integrates and evaluates the existing body of knowledge. So you scan through the articles and then you synthesize all you are finding, not just summarizing them. We are going to see how to do that. Now, at the end of the day, I want us to understand the purpose of literature review, the structure, using the thematic approach, very, very important. How to critically appraise and synthesize evidence, integrates all this literature into one, and then identify knowledge gaps and avoid common errors. Like I said, literature review is a critical synthesis of existing knowledge, a logical narrative that builds towards the study gap, demonstrates that you, the researcher, have actually understood what you are into. If you don't have a background knowledge of what you want to narrate or research into, it will be difficult. So literature review helps you to do this and then provides a justification for your research. Let us understand it's not a textbook chapter. Literature review is not a textbook chapter. It's not a didactic lecture. You're not going to teach us. You're not going to start in the theology of fibroid, literature of fibroid. No. It's not a list of studies without the critique. Each literature must be critically appraised, and it must be devoid of your personal or anecdotal opinions. No, this is literature, this is scientific, published, peer-reviewed articles. And the purpose is to show what is known and unknown. If something is actually out there in the public domain, everybody knows that paracetamol cures a headache. You won't start coming to research whether it will cure headache in my locality, when in the next village it cures headache. So in that way, you avoid waste of resources of men and resources. It demonstrates mastery of the topic and identifying inconsistencies and controversies. That is the important thing. There have been so many studies on a particular subject. Are they consistent? Are there controversies? Are there inconsistencies you want to address? So this will provide central foundation to the research question and help you refine your methodology, because you've seen different methodology apply to the same thing and look at the outcomes. Are they consistent, or do you think you have to tweak the design to get a better outcome? So we recommend, these are what we call the thematic approach, the structure we want. There should be a brief introduction. Like we said, this is what you want to achieve. The search methods. Search methods are important because we want, if somebody should adopt your search methods, you should be able to replicate what you have done. It's not enough to do a review. So let's know how you got there. What are the search engines you use? What are the databases that we are analyze? Unfortunately, some of us will say we done literature searches and I got 16 or 60 articles. It comes to you, the assessor, you just can ordinary Google Scholar or something with refinements, then you are seeing 1,000 articles. Start wondering, are we using the same web? Then again, when you use this search method, remember to use correct terminologies and use their Boolean operators and for, but, not, and all those things. Very, very important. Of course, all this kind of site will throw up millions or even thousands of articles, but you are not going to review all of them. You don't have that kind of time. So you must screen your articles, first of all, from the titles, and then go down to the abstracts to get those ones you want. Oftentimes, we advise you use the PCOS criteria. Is it the same population, intervention, control, outcome, or study design? So at the end, you must tell us the criteria using arriving at the articles eventually reviewed. Then the other thematic areas, definitions and classification. Look at these various articles. How do they define this? Are they consistent? Are there differences? Why the differences? The same thing with epidemiology from global Africa to Nigeria. Then look at pathophysiology, etiology, risk factors, predictors, diagnosis, and all this. So these are the thematic areas. So if you look at the risk factor, let's say something like risk factor, you've looked at 30 articles. You can say, oh, the risk factor for this, for A is B. And this have been reported, these articles A, B, C, D, this agree to that, although there were some differences. So you analyze. So for each, you analyze them, look at what different articles said about the etiology, those on who are consistent with each other, those who counteracted the others, and then why do you think? Is it because of the study design, the sample size, the whatever? That's how you do it, and not just stacking article over each after each other. So for each of these thematic areas, you look at all the articles together, and then come up with a synthesis. At the end, you give us a summary of the knowledge gaps. At the whole end of the whole thing, say these are the summary gaps of the knowledge gaps existed. And if you have the wherewithal to fill all of them, no problem, but you can just choose one or choose two to fill. Okay, so the thematic area, if you use this thematic analysis, it improves clarity and flow. So you go from one team to the other. It helps. It helps the assessor follow your argument, avoid repetition, and it helps integrate multiple studies and support logical progression towards the gap. So I want, if the National College encourages us to adopt this thematic approach, at the end of the day, I think I'll post the national guideline for dissertation. Then how do you critically appraise an article? For each article, ask these questions. What was the study design? Was this study design actually adequate? Was it actually logical for this study? Do you think a better study design would have been better? Was the sample size adequate? You must look at that, because if the sample size is not adequate, you really might not use that study. Were the methods appropriate? Do you think these results are generalizable to Nigeria or our local population? What are the strengths and limitations? And how does this compare with others? So this is what we are going to do with each article. This is how you critically appraise each article, and then you get the information you want. Like, look at this now. You can't say study A found X by study B found Y. No. They say most studies agree with X as a major predictor. However, these other studies have reported higher rates, likely due to late presentation and resource limitation. You can see you are comparing and synthesizing the information from different angles, unlike the first one where I just say this one found this and that one found that. No, we must synthesize. So, and for Nigeria, like I say, use locally credible data sources. NDHS, FMOH report, Federal Ministry of Health, local tertiary hospital studies, the Journal of the Nigerian Postgraduate Medical College, the WAX Journal, the NJCP, our TJOG, and so on and so forth. So what are the gaps that you think you might find out? What has not been studied in Nigeria? Is there anything about this study, about this condition that have not been studied in Nigeria? What controversies remain? Are there methodological weaknesses? And is there any population or setting that is underrepresented? You say, oh, this thing have been every time we just the multiparous women. We've not really tested this thing in nulliparous women. Let's do that. So those are the questions you ask, and then you not get this gap, and this gap must lead directly to your study objective. So the writing style, we advise you use subheadings, short paragraphs, link sentences, let them flow, let it flow. Avoid long quotations, use recent references, 5 to 10 years, and of course, be consistent with the Vancouver. This is what the both colleges have recommended. Vancouver referencing, which in text, know how to cite it in text and at the end of the day. These are errors that must be avoided. Writing as if you are writing a textbook chapter, listing studies without critique, no local data, cherry picking. Cherry picking, you are a literature. Because you want to prove to something, you see the literature that actually said this does not work. You forget about them. You see them, you don't. That's essentially misconduct. All literature available should be reviewed, especially for your institution. Someone wants to look at a trend in her particular institution, and but still plays ignorant to the articles from that particular institution. That is not good. Then if at the end of the day, there is no clear knowledge gap, then what are you trying to research into? Your review should not be so long, should not be more than 10 pages. Of course, plagiarism is a no. And then don't use outdated references. So this is the final. Literary review is not a critical argument, not a summary of different results. Organize it thematically. Always integrate it. Situate it to our local population, to our local perspective. It must end with clear, explicit knowledge gap. And this gap must lead directly to your study objectives. So thank you. I hope I kept to time. Thank you so much, Mr. Moderator. And over to you. I'll be ready to take your questions during the question time. I hope I've not bored you. So if not, thank you, and see you at the Q&A sessions. I hope I was heard.
Yes, we heard you. Madam Moderator, Professor Hajara.
Yes. Professor Hajara was here.
Okay, maybe our network. Tisa, maybe you take over. Okay, Hajara, she's here.
Yeah, she was here.
She's still with us. Hajara, you need to unmute yourself.
Yes, sorry about that. I was not able to unmute myself. That's why. Thank you very
Thank
much, our able secretary, Prof. OUJ. Thank you for that lucid presentation, which was on introduction. And you mentioned that the introduction should follow the funneling approach. You start globally and you move down to what is available locally. And you should actually clearly demonstrate gaps in knowledge and what you intend to do about those gaps. In terms of the literature review, you mentioned that there should be a critical appraisal of the literature, not just listing of what you have searched, and that we should screen our articles and look at the sample designs, the epidemiology, and also come up with a summary of the knowledge gaps and how our study intends to address those gaps. And these gaps should actually speak to our objectives. And you said we should always use the local data. Thank you so much for that presentation. Yes, you were, you kept to time. Our next presenter is no other than our distinguished professor, Professor Muhammad Bukar. He's going to be talking to us about justification, problem statements, aims, and objectives. Professor Bukar.
Okay, thank you very much. Is my slide visible?
Yes, it is.
Okay, thank you very much. Good evening, my teachers, senior colleagues, and trainees. I wish our Christian brothers happy Christmas in arrears and a prosperous New Year in advance. Someone whispered to me that the secretary spent about 20 minutes. So what is sauce for the goose is also sauce for the gander. So I'll take us through problem statements, justifications, aims, and objectives. So in the next 20 minutes or thereabout, participants will learn how to write a robust problem statement, how to write an appealing justification, how to craft an acceptable aim and smarter objectives, and they should be able to recognize common pitfalls. Why in the guideline of the faculty is the problem statement and justification situated? This is the introduction. And this is where the problem statement and justifications are situated. At the end of this section, it should be clear to the reader what the identified research problem is and why it is necessary to study it. So this what is the problem statement and the why is justification under the introduction. But before we go further, it is important for us to have a clear picture of the difference between a problem statement and justification. A problem statement, as the name suggests, is a problem. What is wrong? What is unknown? What is it that you want to resolve? So it identifies a problem and it ends with a research gap. So this is the what. On the other hand, justification is why. Why is it necessary for you to study this problem? And at the end of it, you tell us the significance. What is the import or the importance of studying this particular problem? So the problem statement is the what, while the justification is the why. Oxford Learner's Dictionary defines a problem as a thing that is difficult to deal with or understand. And someone succinctly put it, that bad things happen or good things don't happen. These are problems, aren't they? So what is a problem statement? It should be very clear, concise, and specific to that particular issue the candidate wants to study. What is wrong? Are there certain things that are unknown about it, or are there unresolved or opaque issues regarding that particular issue the candidate wants to study? It's important to remember that the problem statement is the foundation of the proposal. And from the problem statement, the aim, objectives, methodology, and so on and so forth flow. So if the problem statement is solid, that means the foundation is solid and the building can stand. And therefore, the proposal can stand. If the problem statement is weak, that means the story will be on a very weak foundation and that proposal cannot stand. So when you identify the problem statement, you go ahead and do your research and find problem solutions, the problem identified. There are 4 key components of a good proposal statement. Number 1 is the background. You look at what is the ideal. For instance, what is the ideal about the economics of maternal mortality? Postpartum hemorrhage. The ideal is that no one should die postpartum hemorrhage. But what is the current situation? The current situation is about 14 billion die every year. What are the efforts made? Or so many efforts have been made. So what needs to change to improve the consequences of this problem? Next is, what is the evidence? What is this evidence? And you clearly show the gap and then end that with a research problem. So these are the key components of a problem statement. In my degree, or in UMTH, for the past 20 years, preeclampsia and eclampsia has remained unchallenged as the leading cause of maternal mortality. So my examples would be on preeclampsia. So let's look at this example. Preeclampsia remains a major cause of maternal and perinatal morbidity and mortality in Nigeria, despite improvements in antenatal care. Although its pathogenesis is multifactorial, the precise etiology is still not fully understood. What is this? Background. This is the magnitude. Then, recent evidence suggests a possible association between chronic infection, such as Helicobacter pylori, and preeclampsia. What is that? What is the available evidence? However, available studies are few, show conflicting results, and largely originate from non-African populations. In Nigeria, particularly in northeastern region, local data on these associations are scarce. What is this? This is research gap. So consequently, it remains unclear whether Helicobacter pylori infection contributes to the development of preeclampsia among pregnant women in this setting. So this, again, is a problem statement. So it ends with a problem statement. So this have to craft a superb problem statement. What is the implication of a poor problem statement? That means the candidate has not identified the gaps of the study. Or the study is so broad, or the candidate is actually confusing problem statement with justification. And that was why we clearly differentiate ab initio. Oxford Dictionary defines a problem as a thing that is difficult to deal with or understand. So if you say there is paucity of data in this area on your environment, how is that a problem? This is not scientific. You need to lace this with other information to make it convincing. Some candidates write more of a mini literature review as a problem statement. This is a problem statement, not a mini literature review. And as the secretary said, there's no emotion about this. This is about science. This is not a research question, so it should not be written as research. The objective, not traceable to problem statements. How? The objective must be traceable to a problem statement. Justification is the why. Girls have some suitors, 2, 3, 4, but at the end of the day, they settle for one. How do they come to that decision? Because that person is able to justify why she will say, yes, take me to the altar. So it's the same thing. So you think about it. How did you engage your fiancée? How did you win her heart? How did you so translate that to the proposal? And I can tell you your proposal will scale through. So the justification explains why the study is necessary. Convince us why it is timely and why it is worthwhile. Convince the assessors that we are going to add to knowledge, to what is already available. You are going to fill the research gap. Once that is done, your justification is good to go. But remember these key elements. These 5 elements are key when you are crafting justification. Magnitude and importance of a problem, knowledge gap. Importantly, most importantly, it was relevance to local context, the clinical, public health, or policy implications, and contribution to knowledge. Now let's look at this briefly, individually. Magnitude and importance of a problem. Still preeclampsia. Example. Preeclampsia remains a leading cause of maternal and perinatal mortality and morbidity worldwide, accounting for approximately 10 to 50% of maternal death, with a disproportionate burden in low and middle income countries such as Nigeria. Knowledge gap. While several studies have explored infectious risk factors for preeclampsia, there is limited evidence from northeastern Nigeria on the association between H. pylori infection and preeclampsia, despite high prevalence of both conditions in this region. Relevance to local context. Findings from high-income countries may not be generalizable to pregnant women attending UMTH due to differences in socioeconomic status, ancestral characterization, and infection burden. Clinical, public health, or policy implications. Establishing an association between H. pylori infection and preeclampsia could justify routine screening or targeted treatment strategies during antenatal care. Contribution knowledge. This study will provide baseline data and may serve as a foundation for interventional trials and future meta-analysis in similar low resource settings. One who does not believe in candidates cannot reinvent the wheel. If you want to reinvent the wheel, go ahead. What we are interested in is give us a strong problem statement, justify why you want to reinvent the wheel, give us smarter objectives, and let's see how far you can go. But the challenge is that many residents don't have the liver, and I understand that. You can see this resident doctor reinventing a wheel. And some would believe that, well, this looks better than this. But again, be careful, look at the environment why he's inventing the wheel. It's in a forest in Borno State, and I will not mention the name so that others will not log out of fear. Now, when you put all these 5 key components together, the magnitude, the knowledge gap, the local content, contribution knowledge, and blend all, the juice will be mouth-watering. What are the implications of a poor justification? That means there's a poor understanding of the research problem, or the problem is not actually relevant, or you not add anything to the existing body of knowledge. The secretary has mentioned it. Pitfalls. Little is known. Is that a problem? the first in our center. How is that a problem? Why are you restating the problem statement under justification? If your justification is not linking to improvement in patient care, in practice, in policy, so what is the justification about? Why repeat the background verbatim in the problem statement and in justification? Whatever claim you are making, support it with relevant evidence. The importance of the study cannot be overemphasized. That is, I mean, what is it that is not explain to us what is overemphasized in clear terms, not to hide under the importance of this study. Yes, every study, the importance cannot be overemphasized, but what is important is for you to justify this and failing to link justification to objectives. This brings us to AM objectives and research question. And this is from the guideline of the faculty. It says the aim of the study should be stated starting with 2, and the objective should not be more than 5. That is the specific objectives. And this is also from the guideline. 5 objectives. The first one is to review the recent available literature, and the last one is based on the findings. So effectively, we have only 3 specific objectives here. But I think going forward, I mean, this document has been in existence for 10 years. When it comes to review, I think I will align with those who suggest that probably the first objective should be a systematic review on that particular topic without the meta-analysis. And that can be presented at departmental level maybe 3 months after passing part 1. That way, the resident will know the difference between narrative review and literature review, and will understand the rigors involved in systematic reviews. This is a sample of the rubric, how the proposals are assessed. Is there a clear problem statement? Yes, no, comments. Same thing for aims and objectives. Now, the aim. The aim is like the destination, while the objectives are the steps that you take that will take you to that destination. So the aim is like the what. What is the problem? And the objectives are how will you solve the problem? Let's look at this example. Let's say the doctors who are here, what is their aim? It's to become consultant obstetrician and gynecologist. So the aim is broad, it's singular, and it's futuristic. It states what the resident ultimately wants to achieve, to become consultant obstetrician and gynecologist. But it does not explain how this is achieved, because this is in the realm of specific objectives. Like a research aim, it gives direction, but no details. The details are given under the objectives. So, to enroll into accredited institution, attend mandatory courses, pass primary, go for revision courses, do rotations, blah, 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 so on and so forth. At the end of the day, these objectives, if achieved, the resident will now become a consultant obstetrician and gynecologist. And these are the key components that should be captured in the aim. What is this research, or why is this research required? What is this research about? How are you going to achieve that? So, why is this research required to address the role of Helicobacter pylori infection in the prevention of preeclampsia? What is this about the effect of Helicobacter pylori radiation therapy on the incidence of preeclampsia? How are you going to achieve that? Using a randomized control trial. When you package this together, you have a wonderful aim. Now, let's look at these 2 objectives. Objective should be smarter. In the past, we called smart, but now we've added E and R. Smarter, ethical, and researchable. So, non-smarter objective, pregnant women will understand the importance of physical activity. Nothing smart or smarter about this. If you want to craft a smarter objective, look at this. To ensure that at least 75% of pregnant women attending a tertiary clinic engage in a minimum of 30 minutes of moderate intensive physical activity per day, or at least 5 days per week throughout the entire period. What is not smarter about this? It is specific. Target pregnant women. It's moderate intensity. Is it measurable? Yes. 30 minutes per day, 5 days a week, 75% measurable. Is it achievable? Of course. Is it, but of course it's relevant. Is it time bound? Yes, during a certain period. Is it ethical? What is not ethical about this? Is it researchable? What is not researchable about this? So this is smarter objective. Well, remember that each objective should stand alone. So that at the end of your residency training, you can publish at least 3 or 5 from your dissertations. Remember, publication is just about promotion. In fact, in the Asian countries, a good number of groundbreaking researches come from private outfits. So they are not for publishing for promotion. They are publishing to advance science. Remember the acronym? No objection, no objective, no evaluation. So evaluation is a comparison between intention and outcomes. Objectives define intention, therefore without objectives, evaluation is impossible. Appropriately put, no objective, no benchmark, no evaluation. These are the active verbs that is recommended to use for objectives. Don't use consider, inquire, learn, about, understand, and so on and so forth, because these are weak verbs. I remember, objectives must be smarter. The duration of pregnancy is 9 months. The duration of dissertation is about 1 year. So don't go looking for broad aims and objectives. Don't be over-ambitious in your aims and objectives. Someone said that a professor is someone who knows so much about so little. So go for the so little. Focus on a narrow area and make sure you don't go past that. Let's look at the relationship of problem statement, justification, and objectives. The problem statement is like a diagnosis. Justification is why is the treatment needed. Objective is the steps in achieving the treatment. Take home message, the problem statement defines the gap. The justification explains why the gap matters. The aim states what you want to achieve, and the objective show how you will achieve it. Final words? Christopher Columbus said that a diamond in the wrong hands is just a stone. So what the faculty is doing is to convert this stone into diamonds, so that when you send your proposal, you are sending diamond-less proposals. So this is my further reading. Thank you very much for listening. I hope I kept your time. Thank you.
Thank you so much. That was a very brilliant presentation by Professor Muhammad Bukar, the immediate past provost of the College of Medicine, Medical Sciences, University of Maiduguri, and the third member of Senate of our very dear college. Thank you so much. I wanted to do the introduction, but you already started talking. Thank you so much. He has more than 100 presentations, more than 189 YouTube videos, and so many viewers on his website. Thank you so much, sir, for that presentation on justification, problem statement, and aims and objectives. You said that justification is the why the study, and it is necessary. Why is it necessary? What is the relevance? And what is the local context and the contribution to knowledge? For the problem statement, he said that is the what of what we want to do, and it is the foundation of the study. If it is a very bad foundation, your study will not stand. And you talked about it containing background, existing evidence, showing of gaps, and also ending with a problem statement. Under the aims and objectives, you talked about specific objectives being about 5. And the aim is the overall purpose and the destination where we want to be. And the objectives are now no more smart, but smarter, where you included ethical and researchable as the ER there. And you said that the objectives are actually the steps that you will take to achieve the aim. Thank you so much. That was a very brilliant presentation. I will not make a comment whether you kept the time or not, but you did the same thing like the faculty secretary. Thank you so much. Our next presentation is going to be by another distinguished member of our college. She is Adebimpe Ijarotimi. She's going to be talking to us about hypothesis and hypothesis testing. She is a professor of obstetrics and gynecology at the Obafemi Awolowo University, Ile-Ife. She has more than 70 publications, and she's very passionate about reproductive health, and she's an advocate for adolescent sexual and reproductive health issues. She's also a master trainer for the Rotary International Action Group for Reproductive, Maternal, and Child Health. Please make welcome our dear Professor Adebimpe Ijarotimi to give us the topic, hypothesis and hypothesis testing. Thank you so much, Dr. Ijarotimi. The floor is yours.
Yes, thank you so much, Professor Suleiman. Good evening, my teachers, colleagues, and all residents on today's meeting. I appreciate the faculty for giving me this opportunity, and in this segment, I'll be talking about hypothesis and hypothesis testing. We all know that research is built on questions and assumptions. You cannot be a researcher without having questions you want answers to, and sometimes you have assumptions that you want to check or test whether it's true or not. So hypotheses provide a testable statement that bridges theory and empirical investigation. You might have done some literature search, you might have concluded on a particular idea or arrived at a particular statement. So what you know theoretically and what you are going to find out when you investigate is the hypothesis, that's the statement that you are going to make that will help you to connect the two. So hypothesis testing is the statistical framework that is used to evaluate these statements. The objective of this presentation is to understand how hypotheses guide medical research and how hypothesis testing validates clinical findings. And the relevance of this to our field is that it's critical for designing clinical trials, epidemiological studies, and biological investigations. So what is a hypothesis? By definition, is a tentative statement about the relationship between variables that is subject to empirical verification. You have not yet verified it, but you have made the assumption or you have made a statement. So an example is by saying administration of drug X reduces systolic blood pressure in hypertensive patients. You have not tested the drug X, you don't know yet, but you have made that maybe based on what you have searched previously in literature. So you have made that assumption or you have made that statement. Now you will now need to subject it to testing. So what are the characteristics of a good hypothesis? It must be clear and precise. It must be testable and falsifiable. It should be based on existing theory or observation. And, it must be specific in scope. So you must have a clear direction or a specific area that you are addressing. So we have different types of hypothesis, majorly the null hypothesis, which is denoted by HO, which means you are saying that there is no difference or there is no effect of that particular thing on the other variable. Example of a statement of null hypothesis is when you say drug X has no effects on blood pressure, or that drug X and drug Y have they are the same, there's no difference between the two. And then we have the alternative hypothesis, which is denoted by H1. You are saying that an effect or difference exists between the two entities. So for example, you can say drug X lowers the blood pressure compared to placebo, unlike the null hypothesis where you are saying there's no difference between drug X and placebo. So for the alternative hypothesis, you are saying that one lowers the blood pressure or one is better compared to the other one. So our hypothesis can also be directional or non-directional. When we say directional, it means that you are specifying the expected outcome. You are saying, okay, drug X decreases the blood pressure, or drug X brings, or this particular entity brings a positive change in this or results in a positive outcome. But in non-directional, you are only, stating that there is a difference, whether positive or negative, increase or decrease. You are not really concerned with that. You just want to state that, okay, there is a difference, but you are not specifying the direction. So what is the importance of hypothesis in medical research? It provides structure for clinical trial design. It ensures ethical justification for exposing patients to interventions. Because in order for you to say, oh, you want to expose this group of this population to this treatment or to this drug or whatever, you must have an ethical justification for doing this. And by the time you have a clear and concise hypothesis, it can help you, it can guide you towards that. So it also guides the sample size calculation and statistical power, and it forms the basis of evidence-based medicine. When you have a hypothesis and you test it, you can now decide to accept or reject to discard the null hypothesis or fail to discard the null hypothesis. So whatever conclusion you are reaching, you have an evidence for it because you have an hypothesis and you have tested it. So what is the logic of hypothesis testing? It is a decision-making process under uncertainty. That is, you have this statement, but you're not sure. Even though some study might have in your literature review or your theoretical review might have said, okay, this is what obtains. Others might have found something different, or maybe say that is just due to chance. So you need something to help with your decision making process, and that is why you need to test your hypothesis. So it uses sample data to make inference about the population. So you collect your data, you subject it, after formulating your hypothesis, you subject your data to analysis, and then you'll be able to make inference from that. So the process involves formulation of hypothesis. That's the first step, where you formulate your null hypothesis as well as your alternative hypothesis. Then you choose a significance level, that is alpha, which is often set at 5% or 0.05. And then you select an appropriate test statistics based on your study design and data type. There are some tests that are more suitable for some data type or study design. And then you compute the test statistics, after which you will now need to compare it with the critical value or the p-value that you have set as your significance level, and then you make a decision whether you are rejecting or you are failing to reject the null hypothesis. That is, there is a difference, or you are saying that from what you have found, there is no difference. So the key statistical considerations in hypothesis testing involves the significance level. This is the alpha error, the risk of type 1 error. That is when there is a false positive, when there is no difference, but maybe based on a faulty study design or sample size, you are saying that there is actually a significant difference. The p-value is the probability of the observed data under the null hypothesis. What is the probability that the null hypothesis would actually turn out to be correct? So type 1 error is when you are claiming, for instance, if we apply it to the medical field, that you are claiming that treatment works when it doesn't. And because of that, there is risk of a potential harm. So it's a false positive. It doesn't work. There is no effect, but somehow you think that there is an effect based on what you found. And type 2 error is missing a true treatment effect. And this implies that there will be loss of therapeutic opportunity. Power is the ability to dictate clinically meaningful effects. So there are some common statistical tests that can be used when we're testing the hypothesis. This includes the t-test, which can be used to compare means between two patients groups. For example, if you are comparing a particular drug against placebo in looking at the blood pressure outcomes. And then there's also analysis of a variance, ANOVA. This can be used to compare more than two treatment groups. When you have a different multiple treatment groups, you can use ANOVA. And then there's a chi-square test, which is used to test association between categorical variables, while regression analysis can be done to compare excuse me. So for instance, now, if you are looking at continuous outcomes, like you want to test the effects of body mass index on diabetes risk, you can use a regression analysis. So this is just an illustration or another example of the steps in hypothesis testing, where you state your hypothesis, both the null and the alternative hypothesis. You select your test, you set the alpha to whatever level you want, but the commonest one is setting it at 5%. Some can also use 2%. So you collect your data, you compute your test statistics, and then you make your decision. And based on that decision, you make your interpretation to conclude whether there is actually a difference or not. So in a clinical scenario now, if you want to test a new antihypertensive drug or a new form of treatment, and you say that there is no difference between drug X and placebo, maybe you have a patient with a preeclampsia, that there is no difference between a particular drug and placebo in bringing down the blood pressure, your alternative hypothesis, you are saying that there is actually a difference. And then you choose to use the independent t-test, you set your alpha at 0.05. So if by the time you do your analysis, if the p is less than 0.05, so it means that there's actually a statistically significant difference. So you reject the null hypothesis, which says that there's no difference between your test drug and the placebo. So in other words, you now conclude that that particular drug is effective in bringing down the blood pressure. So what are some of the practical things to consider when we're talking about hypothesis testing? You must have an adequate sample size. You must also select the correct test vis-a-vis whether you are analyzing continuous or categorical data. So you must use the correct test. And then it's also important to report effect sizes, not just to talk in absolute terms of a p-value. It's important to report effect sizes and the confidence intervals. We must avoid over-reliance on p-values and consider clinical significance. Something may be statistically significant in the results, but clinically, it may not really make any difference as such. There must also be transparency in reporting our results. So what we need to remember as a part of the philosophical underpinnings of hypothesis testing is that it does not prove a hypothesis, it only provides evidence against the null hypothesis. The results are probabilistic, they are not absolute. So the fact that you are rejecting the null hypothesis may not necessarily mean that that your null hypothesis is totally false. Like I said, it will also need to depend on your sample size. So we must also place emphasis on replication and contextual interpretation of our results. Whatever we do, if somebody, another researcher in another institution follows the same step, the person should also be able to arrive at the same conclusion. And whatever our findings are, we also need to interpret it in our own context. So in conclusion, hypotheses are central to clinical and biomedical research, and hypothesis testing ensures rigor, reproducibility, and ethical validity of our research. So therefore, medical researchers must balance statistical evidence with clinical relevance. These are some of my references. Thank you very much.
Thank you so much, Professor Ijaru, for that brilliant presentation. You talked about hypothesis and hypothesis testing, where you said that hypothesis provides a testable statement, and it should be clear, precise, and based on a theory. And you actually mentioned the issue of the null hypothesis and the alternate hypothesis, and that it's actually what gives you the structure of your clinical design or clinical research. For the hypothesis testing, you said it's a statistical framework used to test the hypothesis. It involves decision-making process under uncertainty, and it uses the sample data to infer about a particular population. Thank you so much for that presentation. We'll move right next to the right away to the next presentation, which is going to be on outcome measures, inclusion and exclusion criteria. And we'll have Professor Ibrahim, Sanusi Muhammad Ibrahim, to take us through that presentation. He is a professor of obstetrics and gynecology from University of Maiduguri Teaching Hospital. He's a laparoscopic surgeon, and he was the former CMAC of the University of Maiduguri Teaching Hospital. And presently, he is the head of department and the deputy provost of the College of Medical Sciences, University of Maiduguri. So, Professor Ibrahim Sanusi, can we have your lecture? The floor is yours. Thank you.
Thank you, Professor Suleiman. Greetings to my trainers, teachers, senior colleagues and our residents who are online with us. My name is Professor Sanusi Ibrahim, and I'm grateful to the faculty, particularly the chairman and the secretary, for bringing me on board. My topic is actually outcome measures, inclusion and exclusion criteria. And of course, these are important area in clinical research. In fact, they form the backbone of any well-designed study. So it's good for us to take a look at them. And of course, the topic right behind the previous presented areas in research by the secretary and the third state member and the very last presenter. I have any declaration to make, and at the end of the exercise, we should be able to, the residents should be able to explain what outcome measures are, inclusion and exclusion criteria in the context of clinical research, should be able to differentiate types of outcome measures and discuss their characteristics, and to explain factors that could influence choice of outcome measures, and of course, definition of inclusion and exclusion criteria, and for us to assess how they can be applied in clinical research. Their impact on study design will be discussed, and lastly, I'll be taking a look at the selected case study just to showcase how outcome measures and selection criteria should be applied. So I intend to do justice to this within the next 15 to 20 minutes. Outcome measures and participant selection criteria are critical components in clinical research. They form the backbone and they ensure validity and ethical compliance. We've discussed introduction, aims and objectives. At the end of the day, once you have put the residents or the candidates have put everything together from the introduction, aims and objective, you have formed the hypothesis. The next thing is to be able to get your ideal study population that is fully representative of your study design. And of course, you have to exclude certain participants from your research study. The common error that we often see in this area is for the candidates to assume that exclusion criteria is opposite of inclusion criteria. When they said they will include women age 18 to 35, then when they get to the exclusion criteria, they will put women age 36 and above will be excluded. It's not so. At the beginning, your studies population, that is those you have already included, are actually from your target population. And your target population, you already have them, is a population of pregnant women, and you have included them in the study. You have the criteria well spelled out. So if for instance, you have explained the specific age group you are going to assess, then you don't need to actually begin to say that you're going to exclude all those ages that are not there. Automatically, they are excluded. So this is a very common, errors which we're going to take a look at in the follow-up examples. So in terms of the definitions, outcome measures are measures chosen to assess the impact of interventions. They are variables used to assess the effect of an intervention or exposure in study design. And they are often stated at the time. In fact, all the time, they should be well conceived, well stated, well known, well determined, well defined before the proposal even begins. You should know what you are out to find, because if you don't have any outcome measure, it means you will not be able to get the nature of study design you should actually put forward. So example of outcome measure, for instance, in a study that is out to assess adolescent sexual health intervention, maybe to take a look at all the package, given to adolescent patients or clients in a hospital. The outcome measures could be incidence of HIV infection, prevalence of herpes simplex virus type 2 infection, prevalence of syphilis and gonorrhea. And of course, another common example is a study that is looking at different methods of cervical ripening and induction of labor. The outcome could be successful induction of labor, duration of active phase labor, induction delivery interval, and uterine hyperstimulation. One key component of outcome measures is the aspect of primary and secondary outcome measures. They are very important. Then, of course, we have tertiary outcome measures. So all these ones will be able to sieve out, enable the candidate to sieve out which outcome measures are very much related, closely related to the subject or the study design. Which one is closely related to the primary objective? Which one is closely related to his research question? Which one is closely related to his hypothesis? So that must be established. If that is established, then it becomes important for you to look at your primary outcome measures along that line. The next question you will ask, this particular primary outcome measures, does it fulfill the criteria, the properties of an ideal outcome measures? If you pick, for instance, in a study that is trying tranexamic acid to reduce in reduction of postpartum hemorrhage, then there are very many variables that you could pick as your primary outcome. For instance, reduction in blood loss. You can decide to, okay, let's take a look at the patient's hemoglobin or the packed cell volume. Let's take a look at duration of admission in the hospital. But you will agree with me that all these, at least one of them, will be very closely related. The other ones may be indirect. So the primary outcome measures are the most important outcomes of the study, and it is determined by the study design and the study size. It represents the main reason why the study is being conducted. And a typical example is what I have depicted here, for this particular study. For this particular study, it's obvious here, maybe for participants or parturients that you institute standard measure for the control of postpartum hemorrhage or blood loss or placebo. Then the other group, the study group, those on the trial arm, that tranexamic acid. So when you look at them, at the end of the day, your primary outcome measure is how much reduction in blood loss were you able to achieve. So that makes sense. Of course, if it makes sense, it means that you are going to define very well what this reduction in blood loss is. How will you measure the blood loss? You must give operational definition of your primary, of all the terms that you have used or you're going to use at the level of proposal. If you say, or you're going to say it's postpartum hemorrhage, how have you defined postpartum hemorrhage? It's not sufficient for you or for the candidate to just take a look at the standard definition of postpartum hemorrhage and put it there as his definition. You should take a look at the operational definition in your own research. Of course, it's ideal for you to keep to standard. If you're going to keep to standard, then you must provide what is required to keep to standard. You must have ideal measurement. You must have ideal, you must be able to assess, the patient must follow the normal protocol. So when you do that, it means that your outcome measures have been properly defined and you can now rely on it. Because if the outcome measures are not well defined, then the validity of your study is at stake. You cannot generalize even your research findings. So this is one major area that is very key in research. Then let's take a look at the secondary outcomes and tertiary outcomes. Often these are additional effects of the study, but they don't directly relate, or they may not relate directly to the area of study by the candidate. For instance, if in the case of postpartum hemorrhage, you want to see if the patient requires blood transfusion, the patient requires duration, you want to assess the duration of hospital stay, this can actually form the secondary outcome. Then, of course, there are other secondary outcomes, or perhaps tertiary outcome that may just serve as a marker, may not be related directly to the to the actual study or actual objective. And this could include maternal satisfaction, long-term health effects. So what are the characteristics of good outcome measures? I've mentioned validity, and of course I have some the depictions here, the internal validity and external validity. In internal validity has to do with the accuracy of your study. You should be able to use a good method. Your methodology must be sound in a way that your result can be trusted. Then if your result is trusted, has the methodology provided opportunity for it to be reproducible outside by other people in a repeated manner? That's external validity. And of course, reliability. Can it be repeated using the same method consistently? So if this must be done, it means that your outcome measures must be applicable in many circumstances. And by the time you add the inclusion and exclusion criteria, you'll be able to see how what you end up obtaining may not necessarily be generalizable or may be generalizable. For instance, if you have an outcome measure that restricts the age group of the participant in your study, it means that your finding, if at all is sound, may not be very useful in another group of patients that do not fall into the age category you have studied. Then, of course, it should be able to determine any change in the difference in the study, particularly when you have to do it for another group of people using the same method. Can you determine any slight change? Then is it of clinical relevance? Is it sound? Has it contributed to knowledge? Can it be used to manage patients? For instance, if you conduct a study on postpartum hemorrhage in your hospital, and you limited your sample size to only a segment of patients, maybe in terms of age, in terms of socioeconomic status, then at the end of the day, it may not be generalizable, in terms of science, then you have not fully contributed. So these are things that, there will be need for the candidate to strike a balance and see how the study could be useful, the findings could be useful from within and even outside. So now, what are those factors that may influence the choice of outcome measures? Let's take a look at the clinical relevance, which I've mentioned, which measures and reflects the outcomes that are meaningful to all. I've said it, the clinical relevance is very important to the doctor or to the physician, it's very important to the patient, it's important to the community, it's important to the academic environment. If the outcome measures are not well specified, and after the end of the study, you discover that your outcome measures have a limitation in terms of the age, it has limitation in terms of the method used, you did not measure they ask you, how did you measure the blood loss? You say, you counted, you use a container to say, okay, did you use gauze? Did you use Abdopack? Did you use suction machine? If you did, then how was the blood in all these areas? How were they assessed? So it means that the methodology, there's a problem. So you're not likely to get any meaningful to make meaningful inference from it. Then the validity and reliability, this measures the generalizability and reproducibility of your findings. Then what of the sensitivity and specificity, the feasibility and practicality of the study, and of course the stakeholder input. This area is very important. In fact, the major reason why this is here is the fact that your outcome measure can be modified by your colleagues, it can be modified by your trainers, it can be modified by consultants in your team, it can even be modified by during, if you decide to do a pilot study, or you just want to test your just at the initial stage, you want to see, can I have a pretest of the my questionnaire? And if that is done, then you discover that there are issues. So you have to go back and redefine your outcome measures, because it becomes obvious to you that you may not actually get what you want to get, because the primary outcome measure is the meat of your study. So in at the level of the department, the college has stipulated that every proposal must be presented. So apart from the fact that the candidate enjoys supervision from the trainers at the level of the department, they still present before final submission to the college. So at this point, there could be input, the outcome measure may change. People may add values. So that's why it's very important that the proposal is presented at the level of the department. Your objective and hypothesis, which measures how your outcome measures align with them, is equally very important. They may influence it. If your objective is to, for instance, in the women you are assessing for postpartum hemorrhage, if, for instance, your objective is to find out how many women died from postpartum hemorrhage, then it means your outcome measure, primary outcome measure, is not likely to be the volume of blood loss. It has to be the number of women that died, from postpartum.
Sorry,
hemorrhage.
Professor Sanusi, I'll need to state here that you have just about 2 minutes more, so that we can quickly round up. Yes, thank you so much. Yes, it's been a night well spent. Yes, thank you.
This is not. This may not be sensible. Why is it not sensible? Because if you end up having such a category of women, you are using mortality as a marker. It may be difficult for you to actually make a sense, because in many hospitals they are able to manage women, prevent postpartum hemorrhage. It will not lead to mortality. So we actually need those things that will cause morbidity, and with that, it may add to knowledge. Then, of course, the ethical standard, comparison with other study and patient population, and potential for bias, all this can actually influence the choice of outcome measure. Sorry. The next area is the inclusion and exclusion criteria, which is an important component of the outcome. It establishes whether the participant has been able to make standard or meet up with the standard expected in the research study. So, of course, you have your target population, and from the target population, you draw your study population. Those study population, there are people that have met the criteria of your inclusion criteria, but you discover that they have one thing or the other that may require them to be excluded. And such things may include demography, like the age or biological factors, the clinical, maybe some patients have sick morbidities, comorbidities, you may have to exclude them. So the fact is that the study population ensure appropriate, that the results are meaningful. The next thing is exclusion criteria, and these are features of the potential study participants who meet the inclusion criteria but present with additional characteristics that could interfere with the success of the study or increase their risk for an unfavorable outcome. Common exclusion criteria include characteristics of eligible individuals that make them highly likely to be lost, for instance, to follow up, miss scheduled appointments, provide inaccurate data, have comorbidities, and all this, of course, will have to be excluded. What are the common errors in exclusion criteria? I'll soon be rounding up in the next 1 minute, please. The common errors using the same variable to define both inclusion and exclusion criteria. For instance, if you know you're going to study female, our pregnant women are female, quite all right, then you say you will exclude male. It doesn't make sense. It's not, exclusion does not mean opposite of inclusion. Pregnancy, of course, you don't need to say you are going to exclude non-pregnant. If they have already given consent, giving consent is actually part and parcel of inclusion criteria. So in your exclusion, you not now say women that you are going to exclude those that have not given consent. Then selecting variables as inclusion criteria that are not related to answering the research question. For instance, age limit, language, geography, smartphones. For example, you want to conduct a study in the antenatal clinic and you said all the women you study are those that have smartphones because you need to reach out to them. So if you need to reach out to them, you have to take a look. These women that those you're going to exclude, would they likely constitute the bulk of the patient that you see? Maybe they don't have telephone, smartphone in your hospital. That's those that you see. So at the end of the day, you discover that the validity of your study will be very much affected. So these are areas you take a look at. They're not describing key variables in the inclusion criteria that are needed to make a statement about the external validity of the study results, like demography, disease severity, ignoring comorbidities. The consequence of this is that after you have concluded your study, then people will not be able to generalize it. They may not be able to apply it. They say, oh, this is limited. Oh, they didn't study women that had diabetes. They excluded, oh, women that age 35 to 40 years. So all these, matters a lot. It's not a crime to exclude them if you feel that they will actually be harmed. The study will not be beneficial to them. But you must have your operational definition that well spelled out your study population, so that at the end of the day, it will be applicable to those that have been defined in your study. So what are the impact of inclusion and exclusion criteria on study design? Recruitment feasibility. This one is very important, especially for residents. Sometimes they limit the criteria for selection. And when you limit criteria for selection, and it's not necessary for you to so limit it, at the end of the day, it takes longer for your study to be collected. That's your sample size. You get your sample size quite all right, but the recruitment process will take more than 2 years. And you can imagine when you are expected to finish your dissertation maybe within a year and go for exam. So you must strike a balance and discuss with your supervisor and present at the level of the department. What of the external validity? These are the broader criteria which improve generalizability. So these ones actually very important, which I mentioned before. The influence, the external validity, internal validity, the same thing. So now I have, this is the last, maybe I have 2 more slides after this. I'm taking a hypothetical case of a study that has to do with efficacy and safety of membrane sweeping with vaginal misoprostol versus vaginal misoprostol alone for cervical ripening and induction of labor. So the objectives are here, research questions and the outcome. For this one, the outcome measures, the primary outcome is the rate of successful cervical ripening and induction of labor. That is the achievement of active phase labor, which makes sense because that is the endpoint of the study. You can see the other outcome measures, mode of delivery. Mode of delivery, vagina assisted cesarean section. This actually reflects that maybe the induction of labor along the line either fail or there has to be additional effort, but they do not directly correlate with the main primary objective. If you take a look at the research question and even the objective, the first objective is to determine and compare the sensitivity, specificity, predictive value, and likelihood ratio of membrane.
Sorry, Professor Sanusi, you may need to round up in 5 seconds because we're already out of time. There are a lot of questions that need to be answered, please.
So
thank you, please.
For this, I'm rounding up. Thank you. For these particular questions, the inclusion criteria have been clearly stated, but I would like to state here, part of the inclusion criteria, no contraindication to vaginal delivery. That's those without contraindication to vaginal delivery only will be, included. But take a look at the exclusion criteria. Here, you have placenta previa, you have active genital herpes infection, you have non-cephalic presentation. Non-cephalic presentation has already been stated that the...
Sorry, Professor Sanusi, I'm sorry I have to stop you here. Yeah, I think thank you so much for
my last
presentation.
Slide. These are my references.
Yes, thank you.
Thank you.
Thank you so much. Yes. Thank you so much. Sorry about that, but we actually have gone beyond time.
Thanks a lot.
Yes, thank you very much. And that was a very brilliant presentation. So we'll go straight to the questions. And there are some that are for the first presenter, OUJ, our distinguished secretary to the college. The question here says, thank you. What do you consider as the fair timeline for proposal? I think you should take the 3 questions together. It's something you can just answer in one question. Is critical appraisal of literature compulsory in writing literature? And then Does this mean chapter 1, introduction and literature review, is chapter 2? I think the secretary OUG can attempt these questions. Thank you, sir.
Thank you, moderator, and thank you, audience, for listening. I actually have posted the college guideline on this chapter. So if you download it, everything is there. So the person that asked the question on literature review, that's exactly what we are saying. Literature review must be critical appraisal of literature, not just summary of different literature. You must critique each article individually. And I gave the templates, the questions you have to ask in order to help you evaluate each literature. After evaluation, you can now synthesize this information and merge it with the other ones. That's the literature review. Then a timeline, well, is there at the, but always once you've passed your part 1 and attended the methodology, what is that? Updates, which is online. Both the West African College offers it online and the National College. That's the time to start. You don't wait, because if you look at your timeline, you must have 12 months between the approval of your proposal to your presenting that dissertation. You must have 12 months. And then remember, the assessors will need an average of 3 months for you to get a very good dissertation, because when you send it to the assessor, they have like 4 to 6 weeks. If there's any correction, it goes back to you, which is where the problem is. By the time that oftentimes the assessor sends back to the candidate keeps it for another 2, 3, 4, 5, 6 months. It comes back to the assessor. Assessor will not need more time, because it's like a new submission again. You have to go through. So oftentimes this ping pong back and forth takes almost a year. So the earlier you submit a proposal, the better. I think that answers the question.
Yes, thank you so much, sir. Just as our secretary said, most of it is in the guidelines. If you look at it, you'll know what the word count is and what should be in the introduction, as well as the literature review. The next question, and also the word count of each of the sections. I think the next question goes to Professor Bukar. He's talking about first in our center that he wants more light on what the pitfalls are. Sir, Professor Bukar.
Thank you very much.
Throw more light on pitfalls. First in our center, what does that mean? Yeah.
Okay, if someone is a firstborn, is that an achievement? It's not an achievement, it's by coincidence. So if the first in your center, is not scientific. But you can add the first in your center when you are able to justify the reason for the study, when you are able to just to bring out the research gap, then you can now slot in the first in our center, but not to bring the first in our center as the most important. So you can list it and justify, but it cannot stand alone as a justification for a study.
Yes, thank you very much, sir. I think there's another question here. Should the problem statement be merged with the introduction, or it should be a separate paragraph, sir?
Okay, fine. You can go either way. If you are on a journey from point A to point B, and there are lone landmarks on the one hand. On the other hand, you have landmarks that will tell you turn left, turn right, turn left, turn right before you get to your destination. Which one will you choose? You choose the one with landmarks. So it's better to have the problem statement clearly stated and the justification so that we guide the assessors. Thank you.
Yes, sir, before you go, sir, there's another question here. Does it necessarily mean that 5 objectives should have 5 research questions, sir?
The simple and straightforward answer is yes. The objectives are standalone. So the research question should also be standalone. So the answer is yes.
Okay. Yes, the other question here is, should the problem statement be merged with the introduction? Okay, I think we've answered this one. Please, sirs and ma'am, what is the faculty stand on the choice of dissertation topic with regards to choice of subspecialty? Also, would really appreciate the faculty if an orientation can be given to post-part 1 candidates on the senior residency posting subspecialty and the structures in place to ease transition into our new senior residency curriculum. I think that goes to the faculty chair, or the faculty secretary can answer this question for us.
No, okay, let me just quickly dismiss that. Thank you very much for your question. We still have a lot of series of webinars coming up to educate our residents on this. For those of you who have accreditation for subspecialties, your research study should be on your subspecialty. You can't come into reproductive medicine subspecialty and do a research on oncology. That's not acceptable. So I think we answered this in the last webinar, if I remember. Then sorry, what was the second question?
No, I think he just wanted an orientation to know whether the post part 1 candidates on whether their senior residency subspecialty should be what they will use for their dissertation topics. I think
Yes,
that's what he
it
was
should be. And I think he asked again about well, we're still going to run some more seminars, webinars on the subspecialty, which will be taken by each subspecialty group. But they should have research topic should be on their subspecialty, but that's what they're going to be examined upon.
Okay. I think, yes, if candidates, please look at the chat box. You can see the college guidelines there. And I think this question has actually been answered. Can a proposal have multiple hypotheses? I think we've answered that. Then keep hypothesis and, okay, I think Ijaro has answered that question. Yes. Somebody is asking, please, is hypothesis testing applicable in observational studies? I think you have answered that too in the group. Then, okay, Ijaro has actually answered most of the questions to her. Somebody is asking whether justification is part of introduction or literature review. I think that has been answered by our secretary. And is there any question we have not answered? Thank you, Ijaro, for attempting the questions so that we don't need to read most of them. Time is actually very well spent. Yes, I think we've gone through most of the questions. The questions have actually been answered in the chat box by Professor Ijaro, so we don't need to just go through that and you see the questions, the answers to many of the questions. And I think one of the requests is for us to have the slides posted. There's been a request for that. So in the absence of any other thing, I don't know whether Mr. Chairman has anything to say before we leave. It's been a very wonderful evening.
Yeah, no, none. Just to thank everybody. Let me thank our senior colleague, Professor Zumibodi, and Co for always being here to guide us. And let me thank the presenters for a great job that they've done. And just to encourage the residents and also attenders, this webinar continues again tomorrow. And tomorrow we're going to have very interesting talk. We're going to conclude this particular part of this webinar series. And that tomorrow we're going to be having talks on measures and limitations, basic statistics, which is quite important for all the residents. Then how do you handle results and ethical considerations? So I think we've done enough today without wasting much time. I will hand over to Mr. Secretary if he has any more announcements. Thank you, everybody, for attending this webinar. God bless. Mr. Secretary?
Okay, thank you, Chairman. I think all that's left to thank the Chairman himself for making this webinar possible, as well as our JAM moderator, Professor Hajara Omar Suleiman. It's been wonderful. I just called her up and was able to stand in for Professor Zike, who actually is still inside the craft as we speak. Let me also thank all the presenters, the third member of Senate, Professor Buka, Professor Sanusi, and Professor Tade Jarutimi. These are wonderful presentations. I would also love to have your slides that for Buka and Sanusi so that we can share with the others. They're already requesting for them. Let me also thank our very senior colleagues that we are here. Professor Migbodo have been here, Professor Adesinyu, Professor Udukobwe, Professor Layemi, Aimaku, Professor Adeniji, Professor Ogunze, Professor Bako, who will be moderating tomorrow, Professor Boniface Ago, Professor Dunjiof Ogwejofo, Professor Makwe Chukwemekeze, Professor Lu, Professor Leje, my Oga, Professor Digwe, Professor Sai, Professor Kikelomo, and our CMDs that left all their duties to be here with us, Professor Kuku, Oni Kuku, and Professor Nzaku. Thanks for joining us. Also, Professor Mahoja, Professor Enaruna, my former HOD. I thank you all for joining. And then Professor Lubukola Additional, Chairman, Western Sector. Thank you, Professor Ogunbode. Thank you for joining us all the way from the Caliphate, Professor Panti. My revered teacher, Professor Ase, who was actually the first to join this webinar. Thank you so much. Also, Professor Lami Julo. Thanks so much, Professor Nwaya, Professor Kasu, Professor Zachary, and all the others. Very senior colleagues here, Associate Professor Kwade, Shehu, my board members, Dr. Segi, Dr. Jumbo Sunday Wakili, Dr. Irene Nicole, Dr. Sefia Usman, Dr. Fami Lucy, Osayende, Osaye, Professor Tekai, thank you for coming. Professor G, you are welcome. Professor Dr. KK Ofreyama Oyeyemi, Dr. Saji Nelson, and then Honorable Treasurer, Professor Nana Madugu. Thank you so much for being with us all through. Dr. Rabia, same to you, Dr. Filani, Dr. Egede, Juliet Ofo, Yakubu, and so many others. So many to mention. So we make it a day tomorrow again at exactly 8 p.m. Nigerian time, but not before I thank my social media, my media platform, led by Dr. Ewara Komomo. This session is also being live streamed on YouTube, and thanks to the to the media platform headed by Ewara and Professor Raji, as well as Dr. Ikpeze. Thank you, everybody. Have a good night and see you again tomorrow. Good night.
Okay, good night, everybody. Thank you so much for the opportunity. Good night.
Good night, Madam Moderator.
Thank you, sir. Professor